So for our first student speaker, I'd like to welcome Ruby Zucker. Ruby Zucker graduated from Smith College in 2012 with a double major in engineering and French studies. After graduating, she completed the post-baccalaureate pre-medical program at Columbia University while working as an office manager at a medical practice in Manhattan, a job which she loved and at which she ended up staying for 4 years. At RWJMS, she is on the operations subcommittee of the Hip Hop Promise Clinic and is currently involved with the creation of a medical school curriculum focused on treating overweight and obese patients. Ruby also used to work as a professional baker. She still loves to bake when someone has a birthday. She also loves to travel with her husband, and in any free time she has, and is very fond of her cat, Hutch. Please welcome Ruby Zucker.
I am fat. If you take my height, I'm 5'9", and my weight, about 230 pounds, and you plug it into a BMI calculator, it will tell you that I am obese. I personally do not like to be called obese. I prefer the term fat. Overweight and obese are terms that are used to differentiate between specific values of BMI, a number based solely on height and weight. BMI only tells you so much. Take, for example, an athlete like Zion Williamson. For those of you who know as little about basketball as I do, he's an 18-year-old basketball star who is on track to quickly becoming an NBA player. He weighs 285 pounds, he can dunk a basketball, and if you calculate his BMI, he is obese. Obese is a term that takes a whole person and reduces them to one number based on a limited amount of information. There is actually a movement to reclaim the word fat in a less derogatory way. So although overweight and obese are the official medical terms, tonight in my talk, I will be using the term fat. Today I want to talk to you about the stigma that fat people face all the time and how they are treated, or more specifically not treated, by doctors. This comes from my own personal experiences as a fat person, as well as the many, many stories I have heard from friends and family who are fat and their experiences interacting with the healthcare system. It turns out that the healthcare system is failing fat patients. In fact, I pose that it can be more dangerous for them, both physically and mentally, than no healthcare at all. I will show this to you by addressing just 4 of the many misconceptions or stigmas that exist. However, I know that not every single person in this room is involved in healthcare, so I want to make a point. My talk is focused on medicine, but our societal prejudices against fat people go far deeper than this one specific area, even though many of us may be fat ourselves or have fat loved ones or friends. My takeaway message for all of you, no matter your profession, be aware of your own biases and consider the reasons behind why you have them. One more thing before we really get started. There are a lot of factors that can influence a person's body, including genetics, socioeconomic class, access to healthy food, knowledge about nutrition, medical conditions, ability to exercise, medications, and psychological issues. And many of these factors are outside a person's control. Fat people are bullied, teased, and lose their jobs because of their size. My talk will not address all of these complex issues today, but I do think it is important to mention them so that you can keep them in mind while we talk about issues of weight and size. You never know the whole story about someone just by looking. Misconception number 1. All fat people are automatically unhealthy. This is simply false. Of course, many fat people are unhealthy, and so are many normal-sized people. I'm not claiming that the correlation between obesity and certain medical conditions is untrue or fabricated. There are conditions that can be prevented or reversed, like with weight loss, like heart problems, and losing weight can help knees and hips, make getting surgeries safer, help with breathing and sleep apnea. However, you should never assume anything about a person's health just by looking at their body, especially if they do not have one of the aforementioned conditions. Assuming a fat person is unhealthy without further investigation is wrong and can lead to horrible outcomes. I have a friend, who I will call Sarah, who has always been in absolute perfect health despite being fat. She lost a lot of weight very quickly when she was about 18. And it turns out that rapid weight loss can be a cause of gallstones. Sarah did develop an acute gallbladder issue. In the hospital, there were not enough beds, so she was lying on a gurney in the hallway of the geriatric ward, which was the only place where they had room. She was in pain, in distress, and alone at the time. Coincidentally, her internist happened to be in the hospital and came by to see her. This doctor said a quick hello and asked how Sarah was doing. Then she pointedly looked at her body and said, "This happened because you need to lose weight." Imagine that, a doctor, a so-called healer, thinking that pointing out Sarah's weight in this moment was somehow the most helpful and compassionate thing she could do. And you might be thinking to yourself, that was just an isolated incident, one person's bad judgment. But weight stigma from doctors is not an isolated incident. In fact, research shows that doctors are the second most common source of weight stigma. They are, sadly, second only to family members and friends. I was misdiagnosed with a medical condition when I was about 15. I was given medication I didn't need, told I might never be able to have children, and spent the next 10 years worrying about it. It was called polycystic ovarian syndrome, until another doctor told me that that diagnosis didn't fit my case at all. Why did this happen? Because PCOS tends to be associated with obesity, and I was a chubby teenager. I definitely fit the bill. But that original doctor never bothered to find out more and follow up on that diagnosis. She felt perfectly fine saying I had PCOS because, after all, I was fat, and therefore must have been unhealthy. And if you still don't believe me, if you're sitting there thinking to yourself, no, I know all about the obesity epidemic, every fat person is sick, there's actually a lot of research in this area. Of course, many fat people are unhealthy, but many are what is considered to be metabolically healthy obese, which means that they do not have even one of the risk factors for health conditions that are commonly associated with obesity. One review of the research done in this area predicts that 1/6 to 2/3 of patients with obesity are actually considered metabolically healthy obese. Think about that for a second. 17 to 67% of the patients you might see in your office actually have perfectly healthy metabolisms and don't have any of the conditions that make us worry, like high blood pressure, high cholesterol, high blood sugar, or low levels of the good cholesterol, HDL. And if you still need something to use to judge someone, the amount of exercise they do is a better and more evidence-based predictor of health than weight. Misconception number 2. It is your job to tell people that they are fat. We live in a society that constantly reminds us of our physical inadequacies. The media is usually blamed for perpetuating these harmful body ideals, but I think our treatment of each other can be the most stigmatizing, whether that is the treatment of our patients or of our family members and friends. My sister recently told me a story about a coworker. Let's call her Susan. They had a health fair at their workplace, the kind of thing where they have booths about nutrition, give away yoga mats, take blood pressures, generally talk about being healthy. My sister asked Susan if she was going to go, and she sadly shook her head and replied, "What are they going to tell me? I already know I'm fat." So there she was, actively avoiding a situation where she could receive potentially helpful information about her health because she was so sure that she would receive some flat, unhelpful comment about her body, as she had clearly heard time and again before. There is actually data that shaming people about their weight can cause psychological damage leading to binge eating, increased stress hormone levels, and possibly worse health outcomes. A systematic review published in 2017 stated, "The greater the weight stigma, the worse the physiological health status of overweight and obese adults." Just think about that. Experiencing weight stigma affects the physical well-being of fat patients. When doctors think they are helping by telling a patient in the hospital in acute pain, this happened because you need to lose weight, they're actually having the opposite effect of what they intended. Instead, for providers to successfully discuss weight loss and health outcomes with patients, there needs to be trust and rapport. At that point, you can talk about healthy interventions that might make them feel better. At that point, you can state the facts with no judgment. A friend told me that her doctor said to her, very tactfully, "Losing weight has helped a lot of my other patients with back problems." And she was able to hear that without feeling judged. But please, 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 don't ever say, "You should lose weight," and leave it at that. Misconception number 3, fad diets work. When I was growing up, my family tried fad diets. It was what we did. Even when I was in middle school, we were dieting. I've done the South Beach diet, the keto diet, the fast metabolism diet. I've done Weight Watchers, Atkins, Ideal Protein. I did a diet where we woke up in the morning at 5 a.m., went for a run before school, and then drank a glass of unsweetened cranberry juice. I've lost 50 pounds, gained back 70 pounds, lost 55 pounds. My weight has been as high as 276 and as low as 200. Here's what I will tell you about fad diets. They don't work. Most are unsustainable for a long time. Many are simply unhealthy. Most people can follow a diet for a few months or even more and lose a lot of weight, but crash dieting hurts our metabolisms and does a lot more harm than good. Losing even a small amount of weight, like 10 pounds, through healthy lifestyle interventions like exercising more and eating vegetables and keeping that weight off is more beneficial than losing 40 pounds on a crash diet only to gain back even more 6 months later. Those of you in healthcare know that there is one so-called diet that is actually proven to improve health outcomes. That is a Mediterranean diet, which is, I think of as less a diet and more a common sense way of eating healthy. It promotes eating lean protein with a heavy emphasis on fish, lots of fruits and vegetables, and good fats. It says a glass of wine with dinner is okay and encourages physical activity and enjoying food. There is no quick fix, magical pill, this is the answer diet. There is eating good, whole food as much as possible and having patience with ourselves. And please don't get me wrong. I am not saying that people should not try to lose weight or that they should feel ashamed if they want to lose weight. Everyone should be as healthy as possible for themselves. Weight loss has benefits. But so many people waste their whole, sometimes very healthy lives living in shame, trying diet after diet, and they waste years of their lives. Misconception number 4. The healthcare system treats fat people equally to normal-sized people. One of my peers recently told me, "I think the healthcare system actually treats obese patients better than other patients. We know they might have more health problems, so we do more to make sure they get good medical care." I was a bit dumbfounded by that. Fat patients are routinely failed by the medical system. We often don't have the equipment to take care of them, like extra large blood pressure cuffs, larger gurneys, big enough MRI machines, scales that go to higher numbers, gowns that fit properly. A friend of mine had knee pain from a sexually transmitted infection that went undiagnosed because doctors just kept telling her she needed to lose weight. There is at least one medical practice in Florida that turns away pregnant patients who weigh more than 200 pounds. Eating disorders can occur in people of any size, and one researcher found that her fat female patients with eating disorders took about 13 years to be diagnosed, while her thin patients with eating disorders took 3 years. That's a 10-year difference for a medical problem to be diagnosed. And you know what? Think about how many people told those fat women with eating disorders, "You're looking great, keep up the good work." And the problem starts as early in our career as medical school. A 2017 study done at the University of Hawaii found that 3 out of 10 medical students felt some discomfort while examining obese patients, and 10.5% of medical students agreed or strongly agreed that it's difficult to feel empathy for obese patients. So now you're probably thinking to yourself, okay, I get that there's a problem, but what can we do? I have a few pieces of advice that I think apply both to being a good doctor and also just to being a compassionate human being. These are things I wish I could go back in time and tell to doctors I've seen, as well as doctors I've heard about secondhand. 1, ask open-ended questions. We love this one in medicine, but I have never had a doctor involve me in the conversation and ask how I'm feeling about my weight. They usually just tell me how they feel about it. 2, ditch your prejudice. Be aware of your biased thoughts, especially the mean or cruel ones. Look at them and put them aside because there's no place for them in medicine. 3, never assume anything. Obesity is not automatically the cause of every problem, and every obese patient is not automatically sick. 4, promote health, not size. Exercise is key. Eating good quality foods is important. Losing even a small amount of weight can help with weight-related issues, but reaching a normal BMI is not a reasonable starting goal. 5, endorse self-acceptance, confidence, and happiness. Mental health is really important. Help your patients remove shame, guilt, and anger around eating, their bodies, and their size. 6, provide support and resources, not commands. As much as you might want to help someone, everyone's journey is their own. You can open the door to a discussion, provide advice, refer to experts, but telling someone just to lose weight and leaving it at that doesn't help anyone. And if you want to stand up and tell me that this list could apply to anything, I wholeheartedly agree with you. But it is a lot easier to say the words than it is to put it into practice and begin to believe it. We must always start with ourselves. It is very difficult to support a fat patient if you yourself are afraid of food, or hate your body, or secretly think that fat people are fat because they're lazy or have no self-control. The idea of accepting your body is not resignation. It is loving what you have now and at the same time working to make it the best it can be. I started this talk by telling you that I am fat. Sometimes I think being fat is almost more of a way of thinking than it is a physical state. I was a really happy and healthy kid growing up, but I was constantly aware of my size, and I was worried that cruel stereotypes were being applied to me. And you know what? They probably were. I am fat. I am also a confident and capable person. I'm a medical student and a newlywed. I love to cook, and I'm a damn good baker. I am defined by more than my size, and that is true for every single person here in this room and every patient that you might see. I wish I could go back in time and talk to my younger self. I think she would be both proud and impressed that I can stand up here in front of a room full of people and affirm my own health and well-being just the way I am, that I can stand outside of our cultural programming about our bodies and proudly say that I am, in fact, fat. Thank you.